Here from Vet Triage. We are going through this February 15, 2015 issue of JAVMA. We're going to be talking about this paper, Epilepsy in Dogs 5 years of age and older, 99 cases from 2006 2011. This comes out of two specialty hospitals in Los Angeles, California, a specialty hospital in Florida, two of those actually, and then another specialty hospital in Delray Oaks, California. Before we begin, I have a video on this channel from a while ago talking about, broadly speaking, what the three categories of neurologic disease typically are. The three are either there's something structurally wrong with the brain, so a brain tumor or a congenital issue or cerebrovascular infarction like a stroke, for example, etc. Or second category is something metabolic. So kidney, liver disease, anesthesia related, toxins, etc. And the final is epilepsy, which is an idiopathic condition due to a chemical imbalance in the brain. And you only can diagnose epilepsy if you rule out the first two things. So with that being said, go watch that video for more details, and let's get into it. The objective here is to classify the etiology of epilepsy and evaluate the use of abnormal neurologic examination findings to predict secondary epilepsy in dogs that are 5 years of age or older. It's a retrospective study, 99 dogs. Procedures include that these dogs were going to be diagnosed with either primary or secondary epilepsy. Secondary epilepsy that had a diagnosis of cancer, neoplasia based on MRI, were included. Results found that 23% of dogs that were 5 to 7 years of age, 45% of dogs 8 to 10 years of age, 39% of dogs 11 to 13 years of age, and 2 of the 7 dogs that were 14 years of age or older had primary epilepsy. So they're saying here that primary epilepsy is also idiopathic epilepsy, meaning there are no structural abnormalities that are found with the dogs on MRI. So it's a chemical imbalance. The prevalence of primary versus secondary epilepsy did not differ among age groups. The proportion of dogs with neoplasia at 5 to 7 years of age were lower than that of the other ages. Abnormal neurologic examination results had a 74% sensitivity and 62% specificity to predict secondary epilepsy. So they're saying secondary epilepsy here is anything that is not due to primary epilepsy, which is the chemical imbalance. I've never heard it called that before, and I'm not sure I like the term. I'd rather it be called secondary seizures, I guess, because epilepsy by itself is supposed to be the diagnosis. So I'm not really sure I like that, but maybe neurologists have their own definitions now. I'm not really sure, but I'm not sure I like that. Anyway, conclusions in clinical relevance. A substantial proportion of dogs that were 5 years of age or older had primary epilepsy. Results indicate that the lack of abnormalities on neurologic examination does not exclude the possibility of intracranial lesions. An MRI with cerebrospinal fluid analysis, when applicable, should be recommended for all dogs with an onset of seizures at 5 years of age or older. All right, introduction. Epilepsy is a term used that describes seizures that results from intracranial causes and only apply to patients that have had at least one seizure and a likelihood of future seizures. Which again, it's a bit of a weird definition, because all dogs that are going to be diagnosed with epilepsy have had at least one seizure, so that's kind of silly. And then a likelihood of future seizures, I'm not sure. I don't know if that's the case. I know what they're trying to say. If you had one, I don't know. If you had one seizure, you're still considered epileptic. I don't know. It's weird to me the way they're defining this. Idiopathic or primary epilepsy is a recurrent seizure disorder without any known cause and no interictal deficits. The seizures are caused by molecular or microscopic abnormalities that cannot be identified with diagnostics. Secondary or symptomatic epilepsy is a result of structural brain disease. Cryptogenic epilepsy, also known as probable symptomatic epilepsy, is defined as seizures that are suspected to be caused by pathological structural brain changes with no lesions detectable through complete diagnostic evaluation. And then finally, reactive epilepsy is a response to brain systemic alterations like electrolyte abnormalities or uremia from kidney disease, for example, or results from hepatic disease, anesthesia-related events, or toxins. Materials and methods. Seizures, either focal or generalized, were found in these dogs. They had a complete neurologic examination by a board-certified neurologist. They all had an MRI. They were excluded if they had any suspected reactive epilepsy resulting from toxin exposure, metabolic disease, or anesthesia-related incident. All dogs had a complete blood count. They had biochemical panel. They had thoracic radiographs. They also had blood pressure. They had thyroxine and triiodothyronine levels, as well as thyroid-stimulating hormone levels and bile acid concentrations. They had echocardiogram, electrocardiography, and abdominal ultrasound. Some of them also had serum antibodies against infectious organisms and PCR, which is polymerase chain reaction, assays for evidence of rickettsial, protozoal, fungal infections, or both types of testing. They used a 0.2 Tesla MRI. So I don't know what Tesla is in this image below, but this is an example of an MRI of a dog. It's an axial view. It's I'm going to guess T2 weighted because of the hyperintensity associated with the cerebrospinal fluid, and then this tumor that is obviously strongly contrast enhancing. It's homogeneous. It's spherical. Anyway, so this is just an example of a brain MRI, and of course you can see all the other structures surrounding the skull, because this is just brain here. But you also have all the muscles and the upper airway or the oral cavity or whatever for this dog. So this is just an example of MRI for those who don't know. MRIs are described by strength of the magnet. 0.2 is very, very, very weak. I'm used to having a 3.0 Tesla. This is a 0.2 Tesla in this study. So right away there's some issue there because you could miss lesions that a stronger magnet MRI would have picked up. Protocols were not standardized for this study, which is another problem that I have with the study. But anyway, some of the images were T1 and T2 weighted pre-contrast spin echo imaging, T1 weighted post-contrast spin echo imaging in axial, coronal, and sagittal planes, FLAIR imaging. Dogs were presumed to have neoplasia when the MRI was consistent with mass lesions on the basis of accepted characteristics. The results were as follows. Most of the dogs were spayed females. Mixed breed dogs were most common, followed by Labradors, then Boxers, and a bunch of other breeds. 35% of dogs had seizures with no identified underlying cause, and the other 65% had a lesion on MRI or abnormalities on CSF analysis. Conditions identified in dogs with secondary epilepsy included intracranial mass, suspected to be neoplasia, encephalitis, or other inflammatory syndromes, hydrocephalus, infarction, or cysts. Another problem here. Not every dog with hydrocephalus, for example, has seizures. You can have plenty of dogs that have breed-related hydrocephalus, and they're not clinical for it. So that's a problem there, I would say. 23% of dogs between the ages of 5 and 7 years of age, 45% of dogs between 8 and 10 years of age, 39% of dogs between 11 and 13, and then 2 of 7 dogs that were 14 years of age or older had primary idiopathic epilepsy. I don't know why they don't calculate the percentage for the dogs that are 14 years of age or older. You already calculated the other percentages. So stupid, man. Sometimes this stuff. No offense to the authors, obviously, but this is stuff that should have been caught by the editors. There was no significant difference in the prevalence of primary versus secondary epilepsy among the age groups. 52% of dogs in the 5 to 7 year age group had secondary epilepsy with cancer. 48% had lesions characterized as other, which include inflammatory or vascular congenital malformations. 100% of the dogs from 8 to 10 years of age, 80% of dogs from 11 to 13 years of age, and 100% of dogs in the 14 year or older age group had neoplasia as the cause of secondary epilepsy. A significant difference was found amongst groups in the etiology of secondary epilepsy, with dogs that were 5 to 7 years of age that had cancer were lower incidence than older ages. 86 dogs out of the 99 had a full neurologic examination performed by a neurologist, with 53 and 33 having abnormal and normal findings respectively. Again, I know they can't perform a neurologic examination from all the dogs because some of them were post-ictal, so it wouldn't be as reliable, maybe, but then why not just change the study and make it where it's more standardized, have all the dogs in the study, get more cases if you want higher numbers. And also, I do think there are some neurologists that do take into account abnormalities of the neurologic examination found on post-ictal dogs. Sometimes you see lateralizing abnormalities post-ictally on these dogs in the neurologic examination that may hint to you that there's a lateralized lesion in the brain. So I just think there needs to be more standardization here. Of the 53 dogs that had abnormal examination findings, 79% had a lesion detected by MRI or had abnormal findings on CSF analysis. Some dogs had both CSF and MRI abnormalities. 45% of dogs with normal examination had secondary epilepsy diagnosed on the basis of MRI or CSF. Abnormal neurologic examination findings had a sensitivity of 74% and a specificity of 62% to predict secondary epilepsy, with positive and negative predictive values of 79% and 55% respectively. Discussion. The estimated prevalence of idiopathic epilepsy in dogs, 0.5% to 5.7%. In people, 50 million people are affected, which makes up 0.8 to 1% of the population. It's the most common disorder of humans for the nervous system. In a long-term study of Labrador retrievers, dogs that had primary epilepsy were between 1 and 5 years of age. In this study of dogs that were 5 years of age or older, the proportion of patients with a diagnosis of primary epilepsy ranged from 23% to 45% depending on the age group, and the prevalence of primary versus secondary epilepsy was not different among age groups. Another study of dogs that were less than 1 year of age to 13 years of age, 25% had primary epilepsy and 61% had secondary or cryptogenic epilepsy. In another study, 21% of dogs that were over 7 years of age had no underlying cause of seizures identified. 13% of dogs over 10 years of age had no lesions either. In this study, the results did not differ much from the other studies, even though the patients here were all 5 years of age or older. 35% of dogs in this study population had primary epilepsy. Among 5 to 7-year-old dogs with secondary epilepsy, in this study, cancer was similar to the prevalence of other causes combined, including inflammatory, vascular, or congenital. The prevalence of neoplasia in dogs that were 8 years of age or older that had secondary epilepsy ranged from 80% to 100% depending on the age group. Of 53 dogs in the study that had abnormal neurologic examination results, 79% had intracranial abnormalities based on MRI or had an abnormal CSF. A substantial proportion of dogs without any deficits on neurologic examination, which were 45%, had a diagnosis of secondary epilepsy. Another study concluded that detection of neurologic deficits during examination was a sensitive means of identifying secondary epilepsy, with normal neurologic examination results indicating primary disease. However, the age range of patients in that study was 2.5 to 8.6 years of age, with a mean of 5.3 years. The sensitivity of neurologic examination abnormalities to predict secondary epilepsy was 74% in this study, with a specificity of 62%. The sensitivity of 74% suggests that a considerable number of canine patients, so about 26% of them, with normal neuroexaminations may be inappropriately presumed to have primary epilepsy if MRI and CSF analysis are not performed. With a negative predictive value of only 55%, a negative result, meaning normal findings on a neurologic examination, would not exclude the possibility of intracranial lesion. Therefore, the results here indicate that MRI and CSF, when applicable, should be recommended to owners of all dogs that were 5 years of age or older with new onset of seizures, regardless of neurologic examination results. Even though MRI is approximately 90% sensitive for detection of cancer, a study of people showed only 38.9% sensitivity for detection of cerebrovascular disease. So I wonder what strength MRI they had in that study, because I'm curious if they had a weaker magnet. Some dogs with secondary epilepsy in this study may have been classified inappropriately as having neoplasia versus another structural abnormality. And I also would say that some dogs in this study could have had a vascular event that just weren't found on MRI as well, and they diagnosed with idiopathic epilepsy. So, I'm not a fan of this study. I know what they're trying to do, and I wish it was more standardized. I wish that they just did a better job. I know it's a retrospective study, of course. You have to deal with that, but it could have been done better on multiple levels, in my opinion, so for what it's worth. But what is good about this study is that we can at least try and push the fact that these dogs require workup. You shouldn't assume idiopathic epilepsy just based on age, and hopefully we have more studies that can compare these things in a better detail. See you guys tomorrow. Bye-bye.